At first, when COVID-19 was reported in China's city of Wuhan, other countries paid little or no attention, and little did they know that the disease could spread that faster to other countries. Indeed, Uganda recorded her first case of COVID-19 on 21st March 2020, and government started putting in place stringent measures to curb the spread of the disease. These measures included identifying the infected persons and tracing for the contacts, but this only worked well in phase 1, 2 and 3. Now, the country is in the fourth phase of the pandemic, where there is widespread community transmission of COVID-19, and according to scientists, this is the most dangerous phase of the pandemic. And if no action is taken in terms of infection prevention and control, the situation might get out of hand.
There are more people who want to test. First of all, the number of infections are increasing. Our curve is going up. Many more people are getting infected, and more deaths. We're recording more deaths. More people are traveling. More people are contacts.
Now, our ICUs are full, our hospitals are full, and if we don't really assist the whole system, we might find ourselves falling prey. Because you'll get sick and you'll come to the hospital and the health worker will say, "I'm sorry, I have no bed," because everybody will be sick.
Records have shown that older persons are most at risk. According to Ministry of Gender, Labour and Social Development, Uganda's generation of an estimated 1.7 million old people is being threatened, requiring urgent interventions to protect them.
COVID-19 is affecting our generation because studies have shown that COVID-19 affects older persons more than any other age group. People who are beyond 60 years and above. And as you know, people, when they reach such age, many underlying health effects, diseases, conditions come in. Most of them have hypertension, diabetes, and these are the breeding ground for COVID-19. So we need to really work very hard to ensure that older persons are protected against COVID-19 so that we continue having them, because they're a source of knowledge to our societies. They are the ones who are still providing care for children who are orphaned and other children who are abandoned.
We have done community awareness, but above all, we want to encourage more people and people who are using these facilities that probably our intervention is small, but we can't do more. We need where we have provided temperature guards, we call upon the institutions to look after this temperature guard and provide probably the cells that are required. But above all, when it gets spoiled, to take responsibility and prepare one plan. We don't know how long COVID will stay, but it's all our responsibility to ensure that we do all that we can to protect older persons in areas where they normally meet. In some places, we went to places where they receive their sage from where government facilities are, and this is basically to ensure that as they come and connect together, we are able to support them to not go away with the COVID. So it's the protection and responsibility to protect is with all of us, both lay people, government offices, and any other stakeholders, including NGOs.
This is when the inclusive COVID-19 response to old people, people with disabilities, and vulnerable persons project comes in handy to protect the lives of those that are most at risk.
As Helpage International, in collaboration with our partners, Uganda Rich Aged Association, we have mobilized some funds from Start Fund to complement the government services and interventions on prevention of COVID-19 spread among older persons and the children under their care. We have done this through enhancing awareness and sensitization on prevention of COVID-19, because most of the messages that were going across were not age-friendly. In most cases, they were written in English. In most cases, they were in smaller fonts that cannot be easily read by the older persons that have eye defects. So we have worked with our partners to ensure that we have age-friendly messages. We have used communication channels that are accessible to older persons. For example, using the community support systems and the peer educators and peer counselors in the society and in the communities where they stay, to ensure that they deliver these messages to the older persons in the most appropriate way, but also in the most appropriate languages that they understand.
If you analyze, you find that older persons are being affected more than other age groups, and this is likely to reduce the number. Already in Uganda, the percentage of older persons is low compared to other age groups because we have a young population. So when we look at COVID-19 coming in at this time, it's likely to wipe out, it may not wipe out, but it's likely to reduce the number of older persons.
The project implemented by Uganda Reach the Aged Association and Help Age International in the 3 regions of Karamoja, Acholi and West Nile in the 5 districts of Abiy, Nakapiripirit, Gulu, Nebi and Ajmani has so far benefited 10,000 older persons and other vulnerable groups like children and people with disabilities. The beneficiaries received hand-washing facilities which were distributed to churches and mosques, masks and sensitized on how to prevent the spread of COVID-19.
We sat down and we saw the only best way we could do is, after the government had now released the lockdown, now it was allowing people to go to churches, people to go to some children to go to schools, and others to go back to normal kind of working. Now we said we cannot help older persons and persons with disability in their individual homes. It's not easy, and in view of also the time and also the resources. But we asked ourselves and said, oh, now how best can we find them? And we realized that at least the older person and a person with disability will always go to church. So, they either go to a church, or they go to a health center, or they go to a cultural center, or they go to a mosque. And so that's how we came up with the saying that we could provide 2 aspects, 2 areas of support. One is under what we call water, sanitation and hygiene. In short, it is WASH. And then the other one is protection. Under the WASH, we provided washing facilities. We talk about containers of water where people can wash their hands without touching the taps, because one of the things that we also avoid is touch. So these facilities that we provided are actually foot managed. People use their feet to step on them, and then they can wash their hands, and then they are clean. But also in these churches we provided, because most of the churches when they are open, they also are resource constrained. They couldn't afford temperature guns. So we also provided temperature guns, which help to check the temperature of whoever comes in. Yes, the support is going in the names of the older persons and persons with disability, but also it's supporting the entire church.
And here in Karamoja, for example, permanent drinking places were one of the areas which were identified as areas of high congregation. So we identified permanent drinking places, churches and mosques, and other cultural institutions where people gather. So we provided them with this kind of facility. This kind of facility is it's a hands-free facility where you don't have to touch anything, but you just use the leg to step, and then the water flows. It comes with this basin, and which has a direct connection to the bucket down that collects the used water, but also it has this big 135-liter container for the water. So it also has this. Sometimes we use tissue here. If someone uses tissue, it can be able to throw here. So the beauty with the facility is it's hands-free, but also it gives someone the opportunity to use it in a free way, where there are no direct contacts in terms of touching different parts of the facility, but also ensuring their safety.
Okay.
And this banner is yours. You can hang it somewhere.
Okay.
People can.
So that this is also a message, eh?
Yeah,
Yes.
can see the message.
People can read.
Yeah.
Can remind them.
Okay.
The beneficiaries from all the regions could not hide their joy, and they commended the implementers for extending a helping hand to them in this critical moment.
We should be aware that COVID-19 is preventable, and government of Uganda and the health institutions have come out with the standard operating procedures that should help us to be able to prevent COVID from attacking us. And many of them are basic hygiene requirements like hand washing or sanitizing, keeping social distance at every one moment. Yeah, those are very, very basic things that we need to ensure. And then always ensure that when you have flu, you put on a mask, like I am doing at this time. And just those three would really do a lot in helping us to fight COVID. We thank this organization for providing us with these facilities, because it will go a long way in helping us in the fight against HIV. I mean, in the fight against COVID-19. We are not so resourced, and when facilities like this are provided for, it reinforces our abilities to reach.
We thank the efforts made, and we thank the people who have endeavored to bring the item like hand washing facility, a temperature gun, and the rest. We so appreciate it for the work you have done. Thank you very much.
And we are really thankful. We have got some elders and even orphans. The church is having a congregation about 200 to 300, but of which we cannot making them satisfactory. But they ask it as 2 entrances. We would put another one at the main gate, and then the other container will be placed at the other side of the church. We are so thankful for the support that we have received today. Our prayer is we shall pray for the continuity of this program, and we shall pray for the leadership of this organization to continue meeting the needs of the Ugandans.
According to Uganda Reach the Aged Association and Help Age International, the aim of the project is to protect older persons because their relatives and Good Samaritans who reach out to them have also been hit hard by the COVID-19 pandemic. The project has also helped create awareness amongst the leaders because it has signaled out the need to prioritize older people and vulnerable populations in COVID-19 response.
When we talk about Tonsemberera, don't move close to me. These ones have grandchildren who jump on them wherever they are. They sleep on the same mattress, but through sensitization now, they are separating the children. They even tell children, wash your hands before you come to me. And also putting on masks. Some of them could not have. We have provided masks. We have even sensitized the task force to give older people, to have special consideration for older when they are dealing with, in the COVID response, when they are dealing with older people and persons with disabilities. They should not only give to those who come, they should find out who else has not come, and the mask is reserved for them.
Uraa is doing great work in complementing government. When COVID-19 came, the ministry developed standard operating procedures. The standard operating procedures that the ministry developed were to help older persons and their caregivers on how to protect older persons from COVID-19. And we participated, the Uraa and Help Age participated in the development of those regulation, of those standard operating procedures. But because COVID-19 came abruptly and all the budgets had been passed, we did not have enough resources to give the all the care that older persons needed. So Uraa coming in to sensitize older persons, providing hand washing facilities and masks has come in handy to support government.
In a nutshell, the inclusive COVID-19 response to old people, people with disabilities and vulnerable persons project has played a commendable role in protecting vulnerable populations against the spread of COVID-19.